Atrial fibrillation, or AFib, is the most common heart rhythm disorder worldwide and can lead to stroke, heart failure, and reduced quality of life. There is data to suggest it may be a risk factor for dementia. Hello, I'm Lisa Hart, and welcome to Your Health. Today I'm joined by Dr. Asim Desai and Dr. Jay Tiongston of Providence Mission Hospital, who are both Mission Heritage Heart Rhythm Specialists. I'd like to welcome them to the show. Thank you both for being here. Now, before we get into any details regarding AFib, what I'd like you to do is both introduce yourselves and give us a brief background of where you've come from and how you arrived here. So I'll start with you, Dr. Tiongston.
Well, my name is Jay Tiongston. I was born in Philadelphia of two Filipino immigrant parents. They're both physicians. So from an early age, I saw this sort of example of how to live and how to help people. So it kind of was an easy sort of place for me to gravitate towards as far as a career. So particularly my mission is to help people, and I always wanted to be able to have longitudinal follow-up as well as work with my hands to help people live longer and live better. So that's why this heart rhythm specialty is really a blessing for me. It perfectly kind of suits my goals in life.
So in particular, what kind of doctors were your parents?
My father is internal medicine,
Okay.
so kind of bread and butter primary care type guy. My mother is OBGYN, so she was the one running off, delivering babies in the middle of the night, whereas he was the one kind of watching us and taking us to our practices.
Was there anything that was AFib related at any time during your studying or practice that kind of steered you in that direction?
Well, there was, my father, who actually had bypass surgery during med school, and at that time I realized I really wanted to just focus on the heart, so I could have more expertise. And then finally, once I started to rotate in cardiology, I really gravitated towards the rhythm. I just found it very fascinating, like a puzzle you have to solve, and you can actually treat and cure at the same time.
Okay, all right. And Dr. Desai?
My name's Asim Desai. I am originally from Chicago and grew up there, went to training in Northwestern and Chicago, and then came out to Southern California since about 2005. I've been here. And like Dr. Tiongston, there's a family history of physicians. My dad was an oncologist, and he actually had a heart attack when he was 37.
Oh, wow.
And then had cardiac arrest when he was 56. And so there's a strong impetus there for me personally to learn about the heart and how to heal. And then I think many of us in medicine make some of our decisions through mentorship, and so I ran across some great attending physicians through my training up at Stanford and sort of took me under their wing, and that's when I was introduced to heart rhythm disorders. And it's amazing the kinds of things we can do now with medical technology, and we see a whole range of ages. Traditional cardiovascular management usually involves people in older age groups. In electrophysiology, we can see people as young as 12 and as old as 105. One of my patients is 105 with a pacemaker, so.
Oh my goodness. Well, yeah, that's quite a range. That's a huge range. Well, let's talk a little bit about what AFib is. Obviously it's related to the heart. It has to do with rhythm. But what does it stand for? And then we'll get into some of the other concerns and things about it.
AFib, or atrial fibrillation, refers to a rhythm disorder of the top chambers, the atria, where essentially they're being activated very erratically, chaotically, and very fast. So we're talking about speeds of 400 to 600 beats per minute in the upper chambers. And because of that, the chamber itself does not have the time or ability to contract like it would normally. So the movement of blood is different because it's more of a wiggle than a contraction. Okay. And therefore that affects the efficiency of the heart as a pump, but also can increase the risk of clot formation because the blood in that chamber can become more static.
Okay, all right. Would you like to add anything to that?
Yeah, and what's interesting about AFib, we sort of think of it as an electrical epidemic as people are living longer. Age is one of the #1 risk factors. It's sort of like arthritis of the electrical system. As we get older, we get scar tissue in our electrical system, so that can be a risk factor. That rapid, irregular pulse that Dr. Tiongston was talking about can weaken the heart muscle, leading to congestive heart failure. And the frequency of AFib it's actually quite common, much more common than you would think when you start talking to people. So the estimate is about 6 million Americans have it now, and that's going to quadruple over the next several decades. Other big risk factors are obesity, and so since we have a fairly high incidence of obesity in the US especially, we're seeing more and more AFib as a result.
Yeah, absolutely. Now you had referred to it as sort of a puzzle, and what about it is the puzzle? Is it where it comes from, which area it resides in?
Well, exactly. As rhythm specialists, we're given this, basically this blueprint, this EKG, which sort of tells us, okay, well, for the trained eye, where is the actual abnormality, right? What is normal, what's abnormal? And also we can identify with the EKG, well, where in the heart is the problem? So there are certain rhythm issues where we can really pinpoint and say, oh, this is where this PVC must be coming from, a certain aspect of the heart, outflow tracts, whatnot. For atrial fibrillation, it's pretty clear that this is just chaotic activation of both sides, both atria, right? So a more global atrial problem.
Now, it seems fairly common, like you mentioned, that there's so many people that are obese and we have a very aging population, so the two factors themselves really are contributing to this as well. So as a whole, what are some of the dangers? I mean, obviously, we're looking at a couple different factors.
Yeah, as far as we mentioned, the clot formation that occurs because of stagnant blood can travel to the brain and cause a stroke, and those clots can travel elsewhere too. So you can get blockages in the intestinal tract. We've had patients even have amputations as a result of clots going to their arteries of their extremities. So stroke is the most common manifestation. That rapid irregular heart rate can cause weakening of the heart muscle, and two kinds of congestive heart failure. One is called systolic, where the heart muscle is weak. The other is called diastolic, where the heart muscle is stiff, and that rapid heart rate makes it hard for the heart to fill with blood. AFib is associated with dementia. We're learning more and more about that as well, and it's kind of a physiologic process. We are also learning that some of the treatments, including something called catheter ablation, may reduce the risk of dementia. There's some exciting data about that. And kind of getting back into the risk factors a little bit, I think another important point is sleep apnea. Sleep apnea is a condition that's under-recognized, underdiagnosed, and we're learning more and more that's a big, big trigger for AFib. And then one last piece is alcohol intake. That's something we're learning more and more about. We used to think that heavy amounts of alcohol was a trigger for AFib, so-called holiday heart. We're now learning, especially with some studies that were presented last year, that even very small amounts of alcohol can actually be associated cumulatively for risk of AFib.
Oh, wow. Well, you must have your hands full now. I think everyone I can't speak for everyone, but a few people may have drank a little bit more than normal over the last 18 months, primarily because they were really close to sitting next to their bar. So, that could contribute. And then as well, stagnant, not exercising. So now we have people who may be significantly overweight because of those things. So would you like to add to that, what he said?
No, exactly that. This problem can affect people's functionality. Some people would rate stroke worse than death in the fact that you're not able to walk, talk, take care of yourself. You become dependent on other people. That's why we have to take it so seriously. And it actually does increase your risk of mortality as well, especially if you have any underlying heart problems such as heart failure.
Right, exactly. And there was a statistic that I read here. It said affects 1 in 4 people over the age of 40 at some point in their life. Well, over the age of 40, you would never think that would happen to you, but then your description of your father was very serious at an early age of 37, was it?
Right, when he had a heart attack, yeah. And the issue with age, what's interesting is we're seeing more and more endurance athletes getting AFib at younger ages, and there's different mechanisms that are postulated for that, but one is a slow resting heart rate, which is due to the vagus nerve, the parasympathetic nervous system, that plays a role somehow in regards to AFib, and so we are seeing younger patients. Genetics, we're learning more and more about genetics and their role in AFib, especially in younger patients. And so age still remains sort of the #1 risk factor. High blood pressure, diabetes, any kind of structural heart disease, any kind of prior heart surgery, for example, can be a risk factor. And the challenge is that with the heart, it's an engine, and you have plumbing, valves, and electricity. And so when the plumbing is blocked up, usually there's classic symptoms, chest discomfort, et cetera. It shows up on a stress test or what's called an angiogram. The electrical system is kind of like in your house or your car. It'll act up sometimes and not act up other times. Show up to your doctor's office or an emergency room, you may be in a normal rhythm. You may have 2 hours of AFib that night and have no idea, and then that causes a stroke. So we can kind of touch on that as well in terms of the different symptoms.
Well, that's kind of frightening because you don't necessarily know
Right.
the symptoms are upon you until maybe it's too late.
Right.
So let's talk about the symptoms. I mean, there are some obvious symptoms, and then there's some that you don't recognize at all. So why don't we start with the ones that are most obvious?
So rapid heartbeat, rapid irregular heartbeat, or palpitations, right? These are common symptoms. Chest discomfort, possibly, shortness of breath. But to be honest, the number one complaint is actually fatigue. Just low energy, lack of energy. And a lot of people can have that and not necessarily think it's due to an abnormal heart rhythm or any heart problem at all. Sometimes people will attribute it to, well, I'm just getting older in my years and I should expect to have a lower energy. That's not necessarily true. Right? I tell my patients, especially if it's episodic, some people look back and say, yeah, there were days in the last month or two where I just didn't have any gas in the tank and I couldn't explain it. Well, those were likely AFib days, right?
Wow. Well, all those things that you described make me sound like I'm going to have a heart attack, like right away. Or if you just have fatigue, well, I have a little one at home and I'm fatigued all the time. I don't get enough sleep, especially women. I don't think we really take any of those things into consideration, do we?
True.
Yeah. So I think that sometimes they mistake some of those symptoms for something else.
And that's the thing about AFib is it often doesn't produce, as Dr. Tiongson said, typical cardiac symptoms. Heart being an engine, when you go into AFib, you lose 20 to 30% of the pump efficiency. And so it makes sense that fatigue is one of the number one factors. It's also a progressive disease. We sort of consider it electrical cancer. So every time you have an AFib episode, it makes it easier to have more AFib. There's a term, AFib begets AFib. And so it's not uncommon for us to get a call about a patient who shows up for gallbladder surgery for the pre-op, and they're in AFib. And you start talking to the patient, and they say, yeah, over the last 4 to 6 months, I've dropped my energy. I thought it was because I wasn't exercising, or as you said, Lisa, not getting good sleep. And so it is this sort of great masquerader in terms of how it presents.
Right. Now, one thing I did want to address, and we'll do this probably later, is you said that when people have sleep apnea, that obviously your heart stops at the time that, isn't that the way that works? Is that your heart stops when you're sleeping?
It can.
Okay.
So you're right. With the actual pauses in your breathing, there can be pauses in your rhythm as well.
Okay.
But if you think about it this way, it's a nightly stressor on your body, on your heart. You oftentimes have decreased oxygenation. So that really accelerates the aging process, of the heart and of the atria.
Right.
Can bring you more to an environment where you can generate AFib.
Right.
Plus the triggered firings that can happen during those episodes too.
Okay, well, good luck with your patients and getting them to wear that thing over their face at night, because I think a lot of them don't want to. But there are some interesting things, and we'll talk about that later, that they now have on the iPhones that can help monitor some of that stuff,
Right.
which I think is remarkable.
Right.
Okay, so let's talk about, we talked about fatigue and weakness and dizziness, but we didn't really talk much about stroke. So tell me some of the precursors to having a stroke.
So, when we talk about stroke in AFib, we think about how do you assess someone's risk. And so there's an algorithm, there's an acronym that we use called CHADS-VASC, and each of the letters stands for a risk factor for AFib. So C is congestive heart failure, H is high blood pressure. And so when we evaluate a patient, we add up the score. And based on the score would dictate who should be on a blood thinner and who should be on other types of treatment. And so oftentimes with stroke, the presenting symptoms would be a speech disturbance, a visual disturbance, motor or sensory loss, and sometimes it can be just being uncoordinated, falling.
Yeah.
We've seen a variety of different presentations. And with AFib, the biggest challenge, Lisa, is that by the time someone comes to the ER with the stroke, the AFib episode may have resolved. And so they have a normal EKG, so we don't think, oh, it's from AFib. If you look at the causes of what's called cryptogenic stroke or stroke of unknown cause, that occurs probably in about 30% of patients who come into the hospital is this unknown cause, and a high percentage of those we're learning now it's due to what we call silent AFib.
Right, wow. Well, it sounds complicated, and we thank you for people like you that know what to do. So, all right, and when we come back, we're going to talk about those things that you can do diagnose, maybe prevention, and how you treat it, all right? Okay.
Great. Thank you.
We're going to take a break right now, but come back and we'll be talking to Dr. Desai and Dr. Tiongson from Providence Mission Hospital.
Oh, life, how we admire you, are deeply fascinated by you. All your twists and turns and wild rides you take us on. The ups and the downs. Life, you live inside all of us, breathing, growing, beating. You are the reason we'll always provide world-class healthcare. Providence, we see the life in you.
Welcome back. Well, today we are joined by Dr. Desai and Dr. Tiongson, who is here on behalf of Providence Mission Hospital, and we are talking about AFib. Well, thank you both for being here again. So the first half we were talking about all the different types of symptoms, you know, kind of scary stuff, you know, things that are really, we need to be paying attention to our body a little bit more. But now we're going to talk about the things that you guys use for treatment. So let's talk a little bit about, you know, diagnosis. Like, how do you referred to the EKG earlier. So is that the only way that you diagnose it?
Thankfully not. You know, there are so many options now with technology, some of which patients can even purchase, you know, at the store, at the Apple store, or online, as well as, you know, monitors that we can have them wear from the office or inject under the skin.
Okay.
So a lot of exciting technology. The Apple Watch touts a mid 80% accuracy at picking up atrial fibrillation, and that's without even the patient looking at their watch. Just by wearing it, it can alarm them.
Wow.
But what's wonderful about that one is you can actually generate an EKG just with your fingertips, and it's recorded to your phone. So sometimes in the clinic, I'll actually just grab my patient's phone and just flick through the actual episodes, and I can tell them whether it's AFib or not.
Oh, that's amazing.
And then the other one is called Cardia. It works with any phone. It doesn't have to be an Apple phone.
Okay. Okay.
Those are the two consumer level types of devices that are pretty exciting.
Well, you know, I was just recently shopping for an iPhone, and I noticed that whatever the latest series is, they have all those goodies on it, and that's just amazing. And here you're saying it's an 80% effective.
Correct.
That's crazy. That is amazing. Are you also utilizing this technology?
Yeah, as Dr. Tiongson said, we've had patients make their own diagnoses. You know, one of the challenges is there's a couple of potential causes for abnormal readings. One can be poor electrode contact with your skin or your finger. The other can be if you're having a lot of extra beats, premature beats. But by and large, it's a very useful tool. And as you mentioned, Lisa, the latest Apple Watch actually has the ability to measure oxygen levels. So we were talking about sleep apnea earlier, so it can be an indicator for that. And as Dr. Tiongson mentioned, we have this amazing set of devices that you can implant under the skin. It's not in the heart, it's just under the skin. Battery life of up to 4 years, wirelessly records your EKG rhythm continuously, sends it to us, to your physician, and so it's really useful for that silent AFib that we were talking about, or assessing the response to treatment.
Right. Wow, that is awesome. What about some other monitors, like you have wired monitors? And so let's say you don't go with the latest technology, but you're going to go with something a little more traditional.
So there's still the traditional Holter monitor, which can last, you know, 1 or 2 days. There's longer ones lasting up to a month called mobile cardiac telemetry, or MCOT.
Okay.
Then there's an easy one actually, which is essentially 0 wires, about the size of my fingers, and literally sticks to the chest with an adhesive. And this one they can shower with, and they never have to take it off. That one lasts even up to 2 weeks.
Oh, wow.
So there's a lot of options now compared to, you know, previous years.
So now that we know what AFib is and the different types of symptoms, tell me a little bit about some of the treatments that are available.
So I would think of it in terms of individualizing to the patient. So we have the stroke prevention part that we touched upon. We have drugs that are used to help slow the heart rate and regulate the rhythm. There's a procedure called cardioversion, where you can deliver an electrical impulse to reset the rhythm in certain cases. And then there's a procedure called catheter ablation that's actually been around now for several decades. There's more and more data showing that earlier intervention with some of these treatments, especially ablation, may result in a much better outcome compared to the conventional drug therapy.
Right.
One of the challenges with drugs is there are a lot of toxicities and side effects, and typically it's not as effective as ablative therapy. That being said, ablation isn't necessarily for everyone, and so it's important to have a conversation with your doctor about that. Jay, any thoughts on that?
Yeah, I agree. You know, too often we'll see patients that have just kind of been progressing literally in their natural history of AFib, and they weren't necessarily being, you know, advised to seek something more definitive, especially when medications are failing. There's no reason to expose your heart and your health to all that, you know, AFib, when we could actually get better control with a procedure, even up to 85% success rates with ablation.
Okay, but do you start with medication first and then go into the ablation, or could you just go straight to the ablation?
That's a topic of debate right now. You know, there are some operators that are looking to be a little bit more aggressive, particularly in the earlier stages, especially in our active patients that really don't want to have, you know, their energy taken away by, you know, certain medications.
Right.
But then again, later on in the disease course, when ablation may not be as effective, right, particularly then for sure it makes sense to use a medication first.
Okay. And what exactly is ablation? I mean, what do you do in the procedure?
There's two phases to it, Lisa. One is what's called three-dimensional mapping. We use a catheter. It almost looks like a catheter is a long, flexible tube, and it has these electrodes on it. It almost looks like a paintbrush. And you move it through the heart, simply through the femoral vein, just a small little insertion in the vessel, and it collects this electrical data and shows us where the problem areas are. We then take that catheter out and we put in a different kind of catheter that can either freeze the circuits, which is called cryoablation, or heat the circuits, which is called radiofrequency energy. The net result, though, is if you have a series of broken wires, so to speak, AFib, we're repairing the insulation, is the idea. With ablation, you're destroying the abnormal tissue. It converts it over to a healthy kind of scar tissue that blocks the impulses from triggering these abnormal rhythms.
Wow, and what is the success rate?
As Dr. Tiongson mentioned, you can have success rates anywhere from 85, sometimes some series have even reported as high as 90%. It's all dependent on the type of AFib someone has, how long they've had AFib for, whether their other medical conditions are being optimized or not, whether the risk factors and the triggers are being optimized or not. And then there's another parameter that people can talk to their doctor about, which is the size of the left atrium. The left atrium is a chamber in the heart where AFib originates from, and the larger it is, the lower the success rates with different treatments. So that's a useful metric for people to talk to their doctor about.
And do you do an awful lot of these ablations? I mean, on a regular basis?
It's honestly, you know, a weekly, sometimes multiple day procedure, multiple procedures in a day type of situation amongst the three operators. So our hospital is very busy, and we know we're only going to get busier because as our population ages in the next, you know, 10, 20 years, we have to be prepared to treat those patients.
Right, exactly. Well, I'm glad that you have all of the treatments that you have available. This is excellent news, especially when you may not have to go through all of what you were saying as they have a progression, but maybe you can minimize that progression by doing that. So it's something that, you know, I remember you had said earlier, you know, you've got a little bit like a puzzle, but you're figuring out the puzzle, and now you have all the pieces, and you have so much technology to help you decide and also to prevent as well, which I am going to lead right into prevention, because you had mentioned some things that are, you know, drinking too much alcohol, obesity, and things like that. I mean, these are tough things to address, especially when we are in a country where we do a lot of that. So what are some preventative measures that you would like to see a society doing right now?
Yeah, absolutely, Lisa. I would think of AFib as almost like a body out of balance. And so in looking at that, you know, good nutrition, good sleep. I mean, sleep is paramount for good health. Trying to keep the stress level down, or at least using various stress management techniques. We know that the brain and the heart are intimately connected, fight or flight response. So you can have arrhythmias get triggered by that type of thing. Weight management is crucial. We mentioned alcohol. And then taking magnesium. Magnesium is one of a variety of electrolytes that's really important in the heart rhythm. And so magnesium, just over-the-counter magnesium, can help in many cases of reducing the premature beats, the skipping beats that can trigger AFib.
Okay. All right. Anything you'd like to add to that?
Yeah, I mean, moderation, life in moderation, exactly as Dr. Desai mentioned, that can include exercise. So sometimes for these people that are, avid ultra marathoners and they have AFib, I have to tell them, well, actually, believe it or not, I'm going to ask you to tone down the exercise, and that oftentimes will help them get control of their rhythm.
Something that I've been hearing a lot lately is about heart health or heart age, if you will. And there's things out there that are allowing you to kind of figure out your heart age. What do you guys do for that?
That's a great question. Because the heart, particularly as it pertains to the rhythm, you really can't see with the traditional testing that would be done in a cardiologist's office, such as a stress test, echocardiogram, the bread and butter types of tests. But there are more sophisticated testing that can be done to look at particularly the amount of scar in the heart, right? That's where things like cardiac MRI come into play. But even during the diagnostic procedures that Dr. Desai and I do, and the treatment procedures, the electrophysiologic study, the ablation, we can actually get a sense of the health of the tissue just by looking at the voltage of the tissue itself. Right? Scar tissue has lower voltage, healthy tissue has higher voltage.
Okay, so you guys can kind of get an idea of whether or not, and also based, of course, on genetics and things that you had said earlier, kind of where there might be going with all of this.
Correct.
Now, stress plays a huge part in all of our lives, of course, and it's hard to reduce stress when you're in a kind of position that you guys are in. Do you have your own hearts checked?
Not often enough, I guess. You want to listen?
Right? Do you guys have like a thing on it? I mean, come on.
Where's my Apple Watch? So yeah, I mean, and kind of also circling back to your question about heart age, we do have something called a coronary calcium score.
Oh.
So, not just sort of talking about arrhythmias, but talking about your heart in general. It's a very quick scan people can do that essentially assesses the amount of plaque in your 3 coronary arteries. And so that is a way of assessing your heart's age, so to speak.
Okay.
And kind of getting into what you were talking about with stress management, I like to think of sort of a resilience toolbox or a stress toolbox, and it can be different for each person. And for one person, it may be going on a run, or another person, it may be being around friends, being in social connections. But all of these being out in nature, meditation, yoga especially, there was actually a study that showed reduced AFib in patients that did yoga. It was a pacemaker study. So there is a lot of interesting stuff out there with regards to healthy lifestyle and how it connects to heart rhythm and heart disease.
Right, I know. I mean, if we would just apply the time, right, to all of these things that we're supposed to be doing, I think we all would be better off. Well, I really appreciate the information. Thank you so much. Now, if someone was interested in learning more about this, you have a particular arena that you do all of this out of. And can you give me that information? What are the numbers and where should they go?
Oh, sure. Our office number, 949-347-2822. Is Dr. Desai, Dr. Hung, and myself. We're the 3 heart electricians for Mission Heritage Medical Group.
Okay.
And our office is on Crown Valley, right at the base of the hill where the hospital is, Mission Hospital is.
Oh, excellent. And in closing, is there anything else you'd like to mention?
Well, thank you so much for this opportunity.
Well, I think it's great to educate everybody on these different types of things that you don't normally talk about or hear about. So I appreciate you taking the time. Thank you.
Yeah, and I think one of the key things maybe take home is just early detection of AFib, early intervention. We have a lot of great treatment options out there, and if people are interested in learning more, they can talk with their cardiologist, see an electrophysiologist. So we're happy to be here. Thanks for having us, Lisa.
Perfect. Well, thank you so much.
You're welcome.
And as Dr. Johnson mentioned, you can always contact them at the Mission Heritage Heart Rhythm Specialist Group. Please join us next time as we discover more about your health.